our introduction to the patient may be somewhere at the midpoint during their pregnancy or even at the beginning of their pregnancy. But that journey might be months long. And so we really do develop a close relationship with them because we are so involved with their care at each step. A patient navigator is someone who assists a patient and her family when there is a fetal anomaly or suspected fetal anomaly found during their pregnancy. One of the things that I do is I assist patients in scheduling any appointments that they need for testing, to get more information about the diagnosis, to connect them with whatever pediatric subspecialist might be needed to get that information, perhaps genetics. A diagnosis can be very overwhelming. There's a lot of information, and patients sometimes, they're very unsure about the path. And so what we do is we help them one step at a time. We assure them that we're going to be there to answer questions and be the support person that they might need and to sort of hold their hand through the process. If a patient navigator was not in place, patients would be left to schedule their own appointments and kind of find their own way, which in a large healthcare system can be very daunting and difficult, especially when you're facing a crisis during your pregnancy where you could really use that extra guidance and help. A patient navigator enters the expectant mother's journey at the juncture where a problem or a potential problem is identified. A physician will come to me and say, I have a patient I need your help with. And the doctor will then go on to explain to me what the findings are, particularly on sonogram that day. Then I'll meet with the patient and potentially her significant other, and we'll sit down, I'll talk to them about next steps. Patients are going to be a lot of times very upset, very emotional, and I try to let them know that I'm going to walk them down this path and be at their side as much as they need for me to be. And let them know that I am available to them, give them my contact information so that they feel confident when they leave that day, they have someone and a connection to our program and our office that they can reach out to. We're really able to provide patients with somewhat of a one-stop shop when they come in for their appointments. The patient navigator helps women who are carrying a pregnancy where there potentially is a fetus with an anomaly. We also care for the really high-risk maternal patient. So this is a mother that has potentially cardiac disease or some other really high-risk condition where we are, again, a point of contact, making appointments for patients, serving, again, as the liaison, the communicator. We schedule multidisciplinary meetings where we sit down with the specialists, the anesthesiologist, nursing, the neonatologist, maternal fetal medicine, the patient's obstetrician. And then one of the things that we do then is make sure that that information gets to the patient's labor and delivery room chart and is communicated to all of the providers and the team so that when the patient does enter the hospital, everyone knows what the plan is for that patient. As much as I give to my patients, I also get back. It's incredibly rewarding following a patient for several months. They feel so joyous and happy on the day that their baby is born and feel so much gratitude towards us for having helped them through that journey.